Have you heard about IV vitamin drips and wondered, do they work or is it just another wellness trend? Today, we're talking specifically about IV vitamin B12, what it does, who it's for, and why it may be the missing piece for your energy and brain health puzzle, at least for some. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. So what is vitamin B12? Vitamin B12, also called cobalamin, is actually a powerhouse nutrient, and your body needs it to produce red blood cells, to make DNA. It keeps your brain and nerves sharp, and it also helps turn food into fuel. Basically, without B12, your cells can't produce energy efficiently. And that's why deficiency symptoms often include fatigue, weakness, brain fog, depression, memory issues, and even numbness or tingling in your hands and feet. And here's something important. Your body can't make B12 on its own. You have to get it from food or supplements. And if you can't absorb it, well, that's where things get a little tricky. And that actually brings up the next point, which is why are so many people deficient in vitamin B12? Interestingly, you may be eating enough B12, but still be deficient. How is that possible? It turns out that B12 absorption is a multi-step process. It starts in your stomach, where stomach acid and a protein called intrinsic factor help your body grab and transport the B12 to your small intestine. And that's the only place it can be absorbed. Now, here's the catch. If you're 50, your stomach likely produces less acid that's needed. If you're vegan or vegetarian, you're not getting enough B12 from food to begin with. And if you're taking acid blockers like PPIs or metformin for diabetes, you're actively blocking B12 absorption. Also, add in gut conditions like celiac disease, SIBO, Crohn's, or even chronic stress that damages the gut lining and leaky gut. And B12 is just not getting in. And that's why symptoms like fatigue, poor memory, or even anxiety are sometimes nutrient deficiencies in disguise. Patients ask us at our IV clinic, why choose IV B12 over oral? So when you take B12 by mouth, your gut has to absorb it. But if your digestive system isn't working properly, like we just discussed, you may only absorb 1 to 2% of that pill. IV B12 bypasses the gut entirely. It delivers the nutrients straight into your bloodstream, where your cells can immediately put it to use. And that means faster results and better outcomes for people with absorption issues, chronic fatigue, or neurological symptoms. So what are the benefits of B12, especially in IV form? Patients often report more energy, better concentration and mental clarity, improved mood and stress resilience in general, enhanced metabolism and help with weight support, deeper sleep, and healthier hair and nails. And if you felt jittery on caffeine, and most of us have, a B12 can be a natural energy boost without the crash of caffeine. Another question that is asked is vitamin B12 safe? Who shouldn't get it? The good news is that B12 is extremely safe. It's a water soluble, so your body takes what it needs and just flushes out the rest. But there's one rare exception. People with Leber's hereditary optic neuropathy, it's a genetic condition, should avoid B12 supplement in the form of cyanocobalamin. In general, when getting vitamin B12, make sure that you're getting the right form. We use at our clinic methylcobalamin or hydroxycobalamin, which are more active and they're better tolerated than the synthetic cyanocobalamin that unfortunately you'll find in most over-the-counter products. How is IV B12 administered at regular wellness clinic, including ours? B12 infusions can be given as a standalone infusion or as a part of combination formula, for example, with vitamin C or other B vitamins, or with minerals and amino acids. If you enjoyed this video, please don't forget to like, share, subscribe, and please share your thoughts in the comments. Thank you so much for watching. Until next time. Bye-bye.